Hello, everyone. Sorry, we had a little bit of a technical hiccup. My name is Kaylee. I work for Dr. Katinka here at the Spero Clinic, and I'm so excited that you guys are here on our webinar today. We are a world-renowned clinic that is totally revolutionizing the way that chronic pain conditions are approached and treated. So I'll tell you more about that in a minute. First and foremost, again, I just want to say thank you. We truly want to help you guys, and the first step to doing that is to get information out to you. So I appreciate you taking the time to be here today. I promise that if you guys will engage in the next 20 minutes, Dr. Katinka has some information that is absolutely going to change your life. And our hope is that you walk away from this webinar knowing these three things. The first, that there is a way to get better that does not involve invasive surgeries and pain medications. The second is that your body was designed to heal, it just needs the tools to do so. And the third is that there's hope and you are not alone. We're also going to present an opportunity for you at the end of this webinar to have a very affordable consultation with Dr. Katinka. It's an amazing opportunity, so I would highly recommend that you guys take us up on that offer. Our dream for every patient is that they are able to leave our clinic and live a normal life. So Dr. Katinka has worked with the hopeless of the hopeless cases, very difficult situations, and she's created an amazing system that is totally changing the lives of chronic pain sufferers. She is an international speaker, an author, and CEO here at Spero Clinic. So without further ado, here is Dr. Katinka.
Hi, thank you, Kelly, for that beautiful introduction. Hi, everybody. Thank you for joining today. I so enjoy connecting with people from all over the world and hearing your stories because it reminds me of the reason I'm doing all of this. I feel that this is my life's purpose and work. I'm very proud of the program we have built and very determined to eventually bring this program out to the rest of the world so that we can start approaching chronic pain in a more logical way. Please, if you have any questions, hi Belgium, post a line on the side and just post your question. I'm going to try to answer a few of those. I do want you to know we have a super exciting offer at the end of this webinar that Kelly is going to talk more about, but it will give you the opportunity to connect with me one-on-one. It's very affordable, and that way I can talk to you personally and find out more about your circumstances and hopefully impart a little bit more of my wisdom. And so I've been on this journey with, like Kaylee said, the hopeless of hopeless patients for 9 years now. And while it was certainly a challenging journey, it's been incredibly rewarding. A quick story. I started my journey with a complex regional pain syndrome patient where these patients feel like they're on fire all the time, and they often, if they do not try to commit suicide, will certainly consider it because life is very, very challenging with these incredibly high pain levels every day. And there are so many other conditions like that. But a local gentleman, Carlos, found me. I always say he was my patient zero. And he walked in with his wife, and she was holding their 9-month-old baby, Sean, that day. We sat down and started covering his history. Carlos didn't speak much, but I could tell that he was in very severe pain. And his wife proceeded to tell me that she had found him very recently just about to commit suicide. And they were very religious. They prayed about it together, talked about it, and he agreed to go to one more doctor if she would agree to accept the fact that he no longer wanted to live, if his pain was never going to change. And so I was that one more doctor. Talk about a massive amount of pressure. The option to fail just didn't exist in my mind, but I felt an incredible responsibility. Lucky for me, and I believe it was fate, I have a procedure that I still use to this day that reactivates the vagus nerve, which is Latin, it means the wandering nerve. It's one of the 12 cranial nerves that do not come through the spinal cord that is massively important to each and every one of you and ignored all the time by allopathic medicine for its role in chronic pain. this one nerve not only controls GI function, but it also controls inflammation in the nervous system. And think about a water hose. If you have your foot on it, if you lift your foot up, you have a massive flow of water. With the vagus nerve, you can have a massive flow of information. And the beauty about this central nervous system and peripheral nervous system is it can be very, very quick. We were trying to think that nerves heal very slowly and it takes a long time. But in our practice, we're actually seeing the opposite, where if it's targeted in the correct way, you can see a very quick change. So not only did Carlos have severe pain, but he could not eat anymore. He was down to chicken broth. And when he did eat, it would ignite his insides where he felt like he just swallowed acid. And so I treated him, reactivated the vagus nerve, and he went home that night and ate a full meal for the first time since he got sick. He came back the next day and told me what had happened, and my life changed in an instant. I became addicted to miracles. And the first thing I want to impart to you guys is that there is no doctor, no treatment, no medicine that is the cure out there, that is going to be your miracle out there. That the miracle of healing, the secret to that all along has been locked inside your body. Our job is just to make sure that that incredible force, intelligence inside of your body can do its job, that it is free to flow to every single cell in your body so that your body can start rehabilitating itself. When you have a cut, let's say you're cutting a carrot, you're making soup, and you cut your finger, you don't sit there looking at the cut saying, oh my gosh, it's never gonna get better, I'm gonna bleed forever and bleed to death. I mean, we just expect that even if you don't put a Band-Aid on it, even if you don't stop the bleeding, eventually that finger is probably going to get better on its own. And we take that for granted, but there are thousands of things that have to go into that finger healing. New skin cells being made and produced, and the blood needs to stop. The white blood cells need to fight infections. You form a scar to make that area stronger now and heal that wound. So there is so much that goes into just healing a small cut, and a lot more that goes into healing chronic pain. And the body knows how to do that if you can simply remind it how again. So what is our system? Why is this so miraculous? Why does everybody in the world not know about it? My simple answer to you is that I don't really know the answer to that. I'm simply going to talk about our system. I'm not here to tell you that we're the only people in the world that have figured out ways around chronic pain. It's just that we are gaining a reputation for helping the most hopeless patients out there. And this is happening all across the world, in Australia, in Europe. And so patients are starting to travel very far away to us. So I have different criteria when I select treatments. Now, I don't just have one tool in my tool belt. Our philosophy is that you need many tools used in conjunction together, where maybe if you used one therapy, let's say oxygen therapy, and now you use it with neuromuscular re-education and detoxification and vagus nerve stimulation, the oxygen therapy by itself becomes 4 times more powerful. So exponentially, these treatments were designed to work together and make each other more powerful. So when you are here, we now have 16 different treatments that we bombard the central nervous system with. My criteria for these treatments are that they are not invasive, so that we cannot possibly damage patients when they come here, and that it treats the body as a whole. You can never just treat a shoulder and say, well, the knee doesn't matter because it's in the lower body. We're just going to treat the shoulder. The shoulder is composed of muscles, tendons, ligaments, yes, but it also has a nerve coming from the central nervous system, which is attached to your brain, which is attached to the spinal cord, which is attached to the lower body. So every single thing in your body affects everything else. And so we certainly have this very holistic approach for treatments, where we treat the body as a whole. Now, something a lot of people don't know is that something small like scar tissue can massively impede your healing. Think of it as a rock in a river. Now, we think of the nervous system as only communicating through nerves. Like if you look at an old map, if you still remember when we had paper maps and you had roads, that's the nervous system. But the truth is that the true nerve communication on a quantum level moves through the body like a wave, or a river that's flowing through the body. And if you have scar tissue anywhere, it creates ripples in that wave, so that scar tissue, even in the foot, could affect maybe upper body pain. And so one of our treatments is very effective at gently breaking up scar tissue. Then we really start from the brain down. You have the brain itself, and the brain, because of trauma, it always remembers trauma. Physical, chemical, and emotional trauma can be caught in a pattern where it is stuck. And so our job is to help the brain become unstuck. And how we do that, we have two specific treatments where we treat the brain, where we measure brainwave activity with EEG equipment and then show the brain that it's messing up. The brain is very strange. While the body was designed to heal itself, the brain was designed to heal injuries that are not recovering, because it is so vital that all the energy in the brain can function every single day to help you just survive. So you need so much energy to walk and so much energy to digest food. And so if you have chronic pain like Ehlers-Danlos Syndrome, or a blown disc, or CRPS in your hand, after a while the brain says, well, this is not getting any better. We're going to start ignoring that. Like a baby that's screaming, you just shut the door to the room so you can no longer hear it. So our job is to show the brain that there's an ongoing problem. The brain can then see it and assist us in your healing, and then we prod that healing along with different treatments. Now, we come from so many different angles, like I measured before. We have noticed that maybe 90% of chronic pain patients also have chronic bacterial and or viral infections. These can be silent. You can have an infection in your bladder or inflammation for the longest time and not know about it. Or you can have a chronic Epstein-Barr, or like most people know it as mono. That is one of the herpes viruses, and it can be active in the nervous system and affect the vagus nerve, keep reinfecting it. So if you do not approach the viral infections, bacterial infections, you're never going to get anywhere treating the central nervous system. So we accept outside blood work, or we do our own draws once it's safe. We treat those infections. We reactivate the cranial nerves. We have a treatment where you actually sit down and you're playing video games. And what we're doing is affecting the muscles around the eyes, which are your cranial nerves, some sensory like hearing, all at the same time to get that brain balance and get your cranial nerves back online. I believe that research of the future will show more and more that these 12 nerves, and by the way, they have to do with seeing, smelling, hearing, tasting, are vitally important, just as important as the spinal cord is to your overall healing. And so we have that treatment that is now being upgraded into a virtual reality treatment. We have neuromuscular re-education, where you hooked up to a very special machine that puts a certain current through the body that is gentle. It's accepted by your nervous system, but at the same time, every physical therapy move you do on this machine is the equivalent of 250 normal physical therapy moves. So when you guys watch our movies, our videos on the Spero Clinic page, and if you're not on Facebook, please join us on Facebook and Instagram. Our clinic is SPERO, the Spero Clinic. We post our success stories, and often we'll have questions where people say, how is it possible that this patient is in a wheelchair for 10 years and here 8 treatments in, they're walking 400 feet? It's because of that very special neuromuscular re-education. I would be nowhere without my team. And so I want to give them a shout out. We have very, very qualified people here. We're constantly in flux. We're constantly combing worldwide for new treatments that are better than old treatments that we have. So the old is full from the bottom. We add a new one on top, which can be very expensive, but it's certainly very rewarding to try to increase our success rate as much as possible. We did do a poll about 6 months ago with 52 exiting patients. These were all complex regional pain syndrome patients. And our overall ongoing decrease of pain or success rate was reported at 84% as long as 8 years out. So those are some pretty good success rates. We are very, very proud of it. We just wish that our approach was more widely known. You know, before I go, one more quick story, Kaylee. My son, who's 11, fractured his clavicle 4 weeks ago. It was a very severe fracture, and he was in level 10 pains. The bone almost came through the skin. I rushed him to the hospital, and he was sobbing with pain. And sitting there, I just had such incredible compassion for the patients that we see, for the parents of patients that we see, because going into ER, they could see the fracture on the x-ray, and they gave him, actually gave him fentanyl to finally break through the pain, gave him opioids, whatever he needed. They understood it, they could see it, they could treat it. You guys, you have invisible pain. Often doctors don't understand it, they cannot see it. And they don't know how to treat it. But I want you to know that there is hope, that your body is amazing, that it was designed to heal, and that we see miracles all the time. So please do not give up. I'm going to hand the camera back to Kaylee so she can talk to you about our offer. Thank you for joining today. It means you still have hope, and I'm proud of you for watching this.
She's amazing. I still love watching her and listening to her talk even after all this time. Okay, so as Dr. Katinka said, we would love to offer you guys a consultation one-on-one with her. In order to do that, I'm going to share my screen with you and show you step-by-step what you need to do. These consultations are $49. It is an amazing value. And like I said, I have absolutely no doubt that she will change your life. I see it every day. So I'm going to go ahead and share my screen with you guys and show you how to book that consultation. Give me 1 second. So the first thing you're going to do is go to www.drkatinka.com. That is drkatinka.com. It is going to pull up a calendar now. It says no times in December. That's because we have a 2-week Christmas break. So our clinic closes pretty much for the rest of the month after this week. So go ahead and push that arrow. It'll take you to January. Now you can see all of the available dates that we have consults, and only people who watch our webinars are available to watch these consults. So it's a very exclusive offer for you guys. So you can go ahead and push whatever date works for you, and then it will show you the times that are available. You can go ahead and click the time that works best for you, confirm, and then it's going to have you enter your information. If you're in the US, please enter your phone number at what's the best number to reach you at. But like this box says, if you're international, please leave your Skype or Zoom information so we can contact you this way. It'll still be a phone consult, but that way we can get in touch with you if you are out of the country. And then you will scroll down for payment, click Pay with PayPal. Even if you don't have PayPal, it's okay. Once you click that, down here, an option will pop up for you to be able to either pay with your debit or credit card. So I do not have any payment information, so I'm going to stop there, but it's pretty straightforward. If you guys have any issues at all booking a consult, you can email me. It's Kaylee at thesperoclinic.com. So Kaylie at the Spero, that's Spero, clinic.com. Thank you guys so much for watching. We hope to hear from some of you guys and maybe even meet some of you someday. Thanks so much. Have a good afternoon.